We're doing a physical exam. I took the patient's vital signs beforehand. Blood pressure was 110/70, pulse rate of a 60, respiratory rate of 16, temperature 98. We did the Snellen chart also earlier. It was vision 20 out of 20. She's cranial nerve number 2 is intact. So I'm going to just walk in, wash my hands, introduce myself. My name is Leonard. I'm going to be a family nurse practitioner student today. Can you say your first and last name?
Janko.
Do you know where you are?
The hospital.
Okay. Do you know what year it is?
2018.
And then who's the president?
True.
Okay. Patient's alert oriented ×4. So I'm just going to come in, inspect the hair follicles around the skin tone, the head symmetry, see if everything's intact. Just come in and just inspect your hair. Just going to feel around for any lesions, anything abnormal, look for anything abnormal. Okay, that's good. And I'm going to just come and palpate your sinuses. Let me know if you have any tenderness. So, any tenderness?
No.
Okay, I'm going to take a look at your eyes, checking your sclera. That's good. Have you look up, pull down your lids, check your conjunctiva. Looks good. And feel for your temporal arteries. Okay. And then come down, open your jaw, close, clench, side to side your jaw. Okay, cranial nerve number 5 is intact also. I'm just going to have you look straight. I'm going to flash a light in both of your eyes and just check for constriction. Okay. That's good. And then I'm going to have you look at this. I'm going to bring it close, up far. I'm going to step back. Usually we have the lights more dim here. I'm going to flash the light right in between. You're just going to look straight. Okay, I'm going to look for any dilation. Okay. You're going to follow my finger. We're just going to just move your eyes and follow it. Okay, cranial nerves number 3, 4, and 6 are intact. Sorry. I'm going to put my hand here and then just withdraw. I'm going to just be checking the other eye. Okay. Just look straight. Okay, looks good. And the next test is we're going to cover your right hand, your right eye. I'm going to cover mine. We're going to be equal length. And then just let me know when you see my fingers. Okay, same thing with this side.
Okay.
Alright, sounds good. And then if I had a fundoscope, I'll also check the eye internally and see what's happening. On this end, we're going to include the eye section and move on to your ears. Take a look at your ears, feel around, checking if there's only some piercings. No knots or lesions or anything. If I had an otoscope, I would use that to inspect the ears. Just going to use a flashlight. Just going to pull the pin up and back. Look for your tympanic membrane, checking your ear canals, some hair follicles in there. And then seeing as far as I can, pull up and back. Okay, that's good. So on this one, I'm going to hit this against my hand, put it up here. Let me know if you hear the sounds on one ear, both ears, or none. Okay. Okay. And the same thing, when I hit it here, put it behind your ear, and then tell me when you don't hear it anymore. I'm going to place it in front of your ear and then tell me when you don't hear it anymore. I mean, until you can't hear it anymore. Okay. So air conduction was longer than bone conduction, so it's intact. So I'm going to whisper letters and numbers and then just repeat it back.
AC4.
And So whisper test, the Weber and Ryan tests are intact. Cranial nerve number 8 is intact. So I'm gonna check her nose, checking for symmetry, seeing how everything's doing. Looks good. And I'm gonna have you just look up. I'm gonna check inside the nose. Just inspecting. Some hair follicles, no deviated septum or anything like that. We would also be assessing smell. Would be cranial nerve number 1. I'm gonna have you just smile without your teeth. Smile without your teeth. Don't show your teeth, yeah. Okay, and then frown. And then puff up your cheeks. And stick out your tongue. Okay, and then raise your eyebrows and bring them down. Okay, facial cranial nerve number 7 is intact also. So I'm gonna have you smile now with your teeth. Okay, and then just checking your teeth, and I'm gonna check your gums also. If I have gloves on, and I'm gonna have you open your mouth. So I'm gonna inspect inside, checking the mucous membranes. Looks all intact. Say hi. Okay, I'm gonna stick out your tongue a little bit. Okay, and I'm gonna check her uvula, cranial nerve 10, and then her gag reflex, padded tongue depressor would be cranial nerve number 9. And then if I have gloves on or gauze, I would check her tongue side to side if you do it side to side. And then cranial nerve number 12 is intact. And with gloves, I would also check inside for any lesions or anything like that. From this end, I'm gonna just listen to your carotid pulse. Okay. How's it feel? Okay, good. And then I'm just gonna feel for your lymph nodes. Septal lines. And your posterior cervical, mostly like deep, so you won't feel it as much. Anterior cervical. Subclavicular. I'm gonna assess your thyroid. So I'm gonna come down. And you're just gonna swallow for me. Okay. It's intact. It's not enlarged or anything. I'm just getting this end. And also, I'll have you flex your head down, flex it back, side, side, rotate it, and then turn it to the side, turn it to the side. And then push on my hand, and then push up, push to the side, push. Okay. Also, I'm gonna come down and just feel the shoulders, see if there's anything abnormal, swollen or anything. And have you shrug your shoulders. Okay. And shrug them again. Cranial nerve number 11 is intact also. Okay, so we're gonna be doing sensation now. So I'm gonna just inspect the anterior, the posterior. So everything's intact, symmetrical. Anterior will be greater than the posterior. I'm gonna have you close your eyes. So I'm gonna just lightly touch certain areas and let me know if you feel it.
Yes.
And then this is gonna be sharp. This is gonna be dull. And then let me know if it's sharp or dull. I'm gonna have you also close your eyes and just let me know the location I pointed at. Okay. And then I'm gonna have one hand out, this one, and then one, and then I'm gonna place an item, and then let me know what it is. Yeah. job. And then I'll keep your eyes closed. And then one finger, let's relax this way. I'm going to bring one finger up and down. Let me know if it's up or down.
Down.
Okay, you can open your eyes now. And then you're going to touch my finger, touch your nose. Okay, and the same thing with the other one. Okay, and then you're just going to go rapidly. That's what you can. Alright, good job. From then on, I'm going to take a look at your hand. And inspect your cap refills. Cap refills here. And then any nodule, tenderness, pain, or anything. Nothing. Okay. Purpose of the exam, I'm just going to assess one side. Normally we do both sides. So I'm going to just check the hair distribution, anything abnormal. I'm going to feel for a radial pulse. I'll just feel for one here too. I'm going to have you squeeze your hand. And then I'm just going to the ulnar and radial down, okay, open. So it should be white. Release one end, should go back to pink, same thing. Open, and then ulnar side, go back to pink. Yep. And then, so just keep a hand out. And then I'm just going to tap here. Let me know if you have any pain, numbness, tingling in your fingers.
Nope.
Okay. And then I'm going to have you just do this, both wrists push against each other. Normally we would do this for a minute. For this example, just a couple of seconds. Any pain, numbness. So, relax it. Okay, I'm just going to have you check the elbow, inspect it. I'll also do on the other side. Just check for any nodes here. And then also lift your arm up. Just check for any axillary nodes also. Okay, good. So we're going to do, in this end, I'm going to get your fingers out, both hands. You're going to bring your fingers down, bring them up, open, close. Okay, and then you're going to flex up, flex down, side, bring up, down, go around. I bring you to your back. I reach up in the back, bring up to the back down, and then cross over, and then cross over. Okay. Then just do this. Okay. So you're gonna push against my resistance also. So push, and push, and then go like this. Push, push down, and then go straight. Push, push, push out, push in. Okay. And then try to keep your fingers open. Push, push. Okay. And just do your thumb. Okay. And do circles. And then you can relax now. I'm going to check your shoulder strength. Gonna feel any pain.
No.
Okay. Any pain?
No.
Any pain? Okay. So I'm gonna take a look at your anterior and posterior of the chest and the back, seeing how everything's intact. And I have you just turn around and inspect your lungs area. We're gonna feel for any tenderness, anything abnormal. Some of this, have you breathe in. Okay. Breathe out. I'm just gonna percuss. So I'm gonna have you cross your arms and then lean forward and then breathe, not too far, and then just breathe in. And you're gonna hold it. I'll let you know when. And then I'm just gonna measure from Okay, so breathe in and hold it. And relax. And then you're gonna breathe in normally, and then you're gonna exhale, and then hold that, hold at the end of your exhale. All right, ready? Go. Okay. Relax. So this is about 3 centimeters. Just normal. And then I'm gonna have you say 99. Just gonna take a listen. Just breathe in and out. Okay. Okay, and then I'm gonna also listen, and then you're just gonna say E, okay, on every section. Okay, and then same thing, and you'll say 99. And then just let me know if you feel any pain. No pain? Any pain? Okay, and now you just turn around. So just be inspecting, just gonna palpate for any tenderness or anything. Okay, and just focus. And then you're just gonna say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Just gonna take a listen.
99.
Just breathe in and out, sorry. So that concludes the respiratory section. I'm just going to inspect also your pericardium area. and look for any, I call it heaves and lifts, and I'm just going to palpate for any thrills. Okay, and I'm going to locate the PMI. It should be on the left side, fifth intercostal space, mectolateral line. I'm going to push up against your breast a little bit. Okay, good. I'm going to take a listen on all 5 areas with the diaphragm, aortic, pulmonic, herbs, tricuspid, mitral. Same thing with the bell, aortic, pulmonic, herbs, tricuspid, and mitral. So have your lean forward a little bit. We'll listen with the bell at the base, aortic, pulmonic. Okay. Now I'm going to have you just lay down. Normally we would have the patient 30 to 45 degrees. We're looking at the right neck, seeing if there's any JVD present, but there's no JVD present at this time. Also, I'm going to inspect again, just noticing if there's anything abnormal, checking also for any heaves or lifts, and feeling for any thrills. Okay. And locating where the PMI is also, left the fifth intercostal, just fill them up. And then listen with my diaphragm on all 5 locations. Aortic, pulmonic, herbs, tricuspid, mitral. Now with the bell, same spots. Aortic, pulmonic, herbs, graphesthesia, mitral. Now just have you lean to your left. And listen with my bell at the base, aortic, and pulmonic. Okay, just have you leg flat. I'm not going to be listening for much longer, but for this exam, we just listen for a couple of seconds. And inspect the abdomen, seeing it's flat, looking for any skin lesions or anything abnormal. I'm just going to take a listen in all 4 quadrants. With the diaphragm, starting over here on the right side. And we just hear rumbling. I'm going to listen at the aorta, usually above the umbilicus. Doing the arteries, usually diagonal of the umbilicus. And then the iliac arteries, the lower half sections. And then the femoral will be on. Also, we'll be listening for much longer than that too. I'm just gonna percuss the liver area, or the abdomen area first, and then around. And then the liver. Take a deep breath in. Okay. small, 4 centimeters. Okay. Sorry. So we're going to percuss the spleen. Deep breath in. Okay. Now I'm going to feel for your liver. Just relax. Go in. And breathe in. Okay. This is also checking Murphy's sign. Any pain? Relax out. Do that. Checking Murphy's sign. Also, I would feel like the end of the liver there. And then just do a light palpation all throughout the stomach. And now the deep palpitations. Any pain? And the spleen. I'm just going to go in. And then, okay. I should really be able to feel it. That's how we relax. And check for the kidneys. Breathe in. Okay, relax. And then same thing here. Breathe in. Okay. Now rebound tenderness. Any pain? And then the rose vein. Pain on the right side. Mm-hmm. And then bend your knee up. Push. Push. Okay, any pain here? Okay. And then do the obturator sign. So lift up. Any pain? Oh, that's over. Pain. So you're gonna bend your knee, lift that up, and then lift it up straight, and your lower back pain. Okay. And then lift up your head. Okay. Negative for any relax. Brzezinski's and Kernick sign. I'm just gonna really rate your pulses. And just feel it for your inguinal nose real quick. Okay. So I'm going to palpate your femoral pulses. Okay, pop the pill. Okay, just checking for edema, checking your skin. And then check your posterior tibial pulses, dorsal patellaris. And since she has nail polish, can't check her cap refills. Just gonna check for leg distribution. We're just gonna lift one leg up, straight up. Okay, that's good. Okay. Okay, and then we're gonna push down, push up. Push side, outside, go around, okay. And then you're going to push in, push out, push up. Okay, bend your knees. And then I'm going to check your knees for any pain, tenderness. Okay, relax your knee. And check for Lachman's. Any pain? Nothing abnormal. You're just going to push out. And then cross one leg over, and then the same thing with this one, cross over. Okay, and now just sit up for me. And come to the edge over here. So you check your deep tendon reflexes. So usually 1 to 2 inches above. Okay, and then flex your bicep. Okay, and then relax. Okay, and then you're going to do tricep. Okay, and then relax your knee. For a soft spot. toes. And then I'm just going to have you stand up. I'm going to have you sit straight, arms to the side, look straight. I'm just going to watch for any swaying or anything, the lumbar test. And then I'm going to have you close your eyes. I'll just be here in case you fall. Okay, good. And I'm just going to put my hands on your hips. And you're just going to bend and I'm going to check your spine. Okay, that's good. Up. Okay, and then you're going to bend over again. And then come back up. And then arch your back. And we'll go to the side. Side to side. And then twist. Okay, you're going to walk on your toes. And then come back walking on your heels. And then you walk one foot in front of the other. And then you're going to come back just walking normally. And then you're just going to flex up, flex back. And then down, and then we're going to push up. And then push this side. Oops, outside, inside. And then back up, back, side, side. Okay. And then we're just going to go around and around. And that concludes our physical exam.